Hello, today we are here with Dr. Adnan and we are going to talk about patients after a massive weight loss and after bariatric surgery. So Dr. Adnan, could you please explain or talk about how you deal with such patients?
Okay, so these are very complex patients in terms of what their requirements are. They're extremely challenging to perform. So broadly speaking, these are patients who have basically been obese all their life, very high BMIs, and usually they undergo some sort of a gastric procedure, and then they lose a lot of weight very quickly, usually within 6 months after the procedure. The commonest performed procedures in this regard are the gastric bypass techniques, such as the Roux-en-Y we call it, or the gastric sleeve procedures. Occasionally some people also choose to have other procedures like gastric bypass or gastric balloons to achieve this. Whichever way it's done, after a period of few months, patients suddenly lose a lot of weight because the stomach volume and capacity has been reduced. So these procedures are done by a general surgeon who is qualified and trained to do so. I, however, am a plastic surgeon, so my involvement comes after they've lost a lot of this weight, and they come and see me because they've lost all of the fat cells and suddenly they have excess skin, or apron as we call it, which interferes with their day-to-day life. And a lot of patients don't imagine that this would be an issue at the time of the gastric bypass surgery. They think once they've had the bypass, they'll lose the weight and life will be normal. It's actually not like that at all. The body takes a huge hit after these procedures, both with the physical appearance and metabolically as well inside. So there's certainly a lot more going on. Once they lose all the weight, I give the analogy of a stretch balloon. If you take the air out, you've got all of those excess wrinkly skin. And I've seen patients, for example, where the stomach skin is reaching the mid-thigh level and they struggle to even put their trousers on or wear anything to secure that excess skin. So that's where I come in, and that's called surgery after massive weight loss. This is probably the most challenging type of surgeries in aesthetic surgeries, because it takes a long time to do one such procedure, and it has to be staged, and I always stage these procedures. So for example, I would never take too much on in one sitting. These are 7-8 hour operations sometimes, and I would address a region of the body in one sitting. Certainly before even they end up in theatre, there's a lot of planning involved. So I would make sure that they have been cleared by the general surgeon for me to do these type of procedures. I make sure that they have been optimized in terms of their diet and so on, ideally by a dietitian or a nutrition specialist. And there's a series of blood tests that are done to make sure that the surgery is done safely. So for example, the commonest type of procedures done would be an upper body lift or a lower body lift or a bell lipectomy as we call it. And sometimes there are some combinations or adjuncts as well. These type of surgeries, I won't classify them as aesthetic, they're more functional. There are large areas of scars involved, there are lots of healing that has to take place. And it can take anything between a month to 6 weeks before full healing. The bracket of complications in this subgroup of patients is also very high. So these patients, for example, have more wound healing issues or potential seroma formations and so on and so forth, compared to an individual of the same age who may not be that obese previously. So these are challenging patients, and my job as a plastic surgeon is to educate them at the time of consultation. I give them a lot of written information to read about so we can plan the surgery in a safe fashion. For me, safety is paramount in these group of patients.
I see. And this kind of surgery can be done in one time, right? Or you can divide if the area is very big and the whole body is included in that. So you can do, can you do it in one time?
I would advise against that. I guess everything's possible, but I would always stage these procedures given the length of time and the amount of stitching that's required. Of course, it helps if there are two surgeons working simultaneously. So it all depends on the setup of your team and your facilities where you're working. For me, I'm usually on my own when I'm operating with the scrum nurse. So So I always like to stage these procedures. For example, if it's just the arms, and then I would do the arms and maybe the upper body lift at the same time and then stop. And maybe 3 to 6 months later, I will do a stage 2 where I could do a circumferential belt lipectomy, as we call it, which addresses the stomach, the flanks and the back area. And then stage 3, I would address the thighs and perhaps the legs as well to a degree. Usually that's how I plan my surgeries.
Amazing. And everything will be okay after the surgery, I'm sure about it. But the recovery period, as you told that it's very long, and what exactly they have to consider during this?
So I think having the time to recover after this is extremely important. There is a lot of downtime involved, more than normal patients would have to go through. It can take a couple of months before all the scars and healing has happened. They have to wear a garment afterwards, and usually the surgery would also involve a stay in hospital for a couple of nights at least. So it's quite complex and challenging, and there's a long recovery time involved. And I always say that, look, it's important to be safe. If you try and do too much in one sitting, you are increasing the chances of complications, not just from the surgery, but from anesthesia as well. So it's very, very important for me to stay safe. And I explain this to all my clients at the time of consultation.
Thank you so much, Dr. Adnan.
Thank you very much.